this is Bob McMullen, and I've noticed that we're having some trouble with the EBM assignment number 1, which is the 5 PICO questions, and assignment number 2, which is collecting abstracts from articles that you think answer the 5 questions from assignment number 1. In talking to some of you on Zoom here, I have found that there's actually been kind of a paradigm shift in performing evidence-based medicine since I originally created this course and its online materials back in 2007. So I wanted to just go through real quickly an example for you so that you can see what people have been asking about writing the questions, as well as what they've been asking about finding the articles. So I'm going to share my screen. There we go. And thanks to one of your classmates, I have received their permission to use one of their questions, and we're going to go through this together. So the draft of the question was among patients with, and this is the way that she actually wrote it. And that's good. The first step in doing this is to write the question down the way you would say it, okay? So if you were standing there and you were asking a student or a supervising physician was asking you a question, this is how they might put it. So among patients with neutropenic sepsis, is the addition of IV steroids successful at treating refractory hypotension compared to standard therapy alone? What we're trying to learn in this course is we're trying to learn a method, step-by-step method that we can use to better formulate the question to more easily be able to find the answer. And we're using a mnemonic called PICO, where P is the population, I is the intervention you're interested in, C is the comparison, and O is the outcome. So I would love it if you guys would formulate your assignment 2 this way, put down your question, and then break it up for me so that I can see that you know which part of the question goes where. So what's the population? Population is patients with neutropenic sepsis and refractory hypotension. Okay, so that's your patient population that you're interested in. And it's okay to go ahead and be as detailed as you want in your question, because if you score 100% when you go to search for the answer to this question and it comes up with a meta-analysis about patients with neutropenic sepsis and refractory hypotension that we gave steroids and we didn't give steroids, that's perfect. So start detailed, and then we can I'll show you how we work our way back to a more general question if we need to. But your initial question, patients with neutropenic sepsis and refractory hypotension. Now, what is the intervention? You want to add IV steroids. That's the intervention that you're interested in looking at. Now, what's the comparison? A lot of times, the comparison isn't actually in the question. In this case, she did put it in here, so we're comparing to standard therapy alone. And I don't do a lot of work with neutropenic sepsis with refractory hypotension, but I'm assuming you could word that as no steroids. And then what's the outcome? Now this is where most of you are having the most problem, is you're using words like successful or effective or safe. If you read a journal article, you're not going to usually see the summary saying that such and such is successful. What you're looking for is what are you actually going to treat? Like I was talking last night with this student. If you're standing there and whoever walks up to you and says, I want to do a research project and I want us to answer the question, do patients with neutropenic sepsis and refractory hypotension do better with IV steroids or without? Then the question would be, okay, we're gonna randomly take the next 100 patients with neutropenic sepsis and refractory hypotension, and we're gonna randomize them to either getting steroids or not getting steroids. What specific measures are we going to have to collect in order to publish this study and show that IV steroids were or were not successful? A measure of success. Well, the overall measure of success would be morbidity and mortality. Other things you might look at would be, how about serum lactate at 7 days? Just making stuff up. It's however you decide. It might be survival to discharge. It might be 5-year survival. So any of those things, you're the one who's got the patient in front of you. You're the one who's asking the question, what is it that you want to know? You're giving these IV steroids or not because you want to affect which one of these things. Maybe you don't care about serum lactate levels. You realize that that doesn't really have anything to do with morbidity and mortality. Or maybe it does. I don't know. But this is where most of you are having trouble. So go through and find these general words that we use all the time in conversation: successful, effective, harmful. What harm? If you were doing a harm question and you wanted to know if something was harmful, what are you looking for? There's not a serum harm level. You have to see, we're looking at, recurrence of TIA or, whatever it is. Okay, so now you've got your question. Let's leave those there, all right? You're actually looking at morbidity and mortality, let's say. And let's take a look at the next step. So this is assignment 1. So assignment 1 is to make 5 questions. Now, I put down that that's the draft question. At this point, you could probably rewrite it. This was actually very well written to begin with. But let's make it, so our final question, we have to get rid of this successful, so it's morbidity and mortality. And the only other thing you might want to include in your question would be, what is standard therapy? Let's just say it's no IV steroids. I don't know if that's true or not, but let's just say it is, okay? So there's your question. It's nice to have it laid out this way because each of these are keywords that you can now use to look for the answer. So now you're going to take these keywords and you're going to go to the library, at least if you do it the way that I have designed the course and the way that we always teach you to do. You're going to go to the library, you're going to click on something like PubMed, and you're going to see if you can search and find that information. So if you click on advanced search, and then you log in. Sorry, I was going to do this before we started this. All right, and here we are on the search bar. Let me move this down here. Okay, so here's our builder. You can either write your question in here or you can build it. I find that it's easier to build it because it's easier to change it later. So what's the first thing? We want articles about people with neutropenic sepsis and refractory hypotension. And we want to talk about IV steroids. So let's just put in steroids. And we want to compare that to standard therapy. You can put that, but you don't have to. Okay, the main thing is steroids, is the intervention that you're looking for. And then the follow-up would be morbidity and mortality. Now notice I've got ands here. So this is only going to pull up journal articles that have neutropenic sepsis, refractory hypotension, steroids, morbidity, and mortality listed. So let's start with it. Let's see. And we hit search. And we get no results. All right, well that didn't work. So what we have to do is we have to better refine our, in other words, there are no articles in this database that have just those things. So let's go back, and now it's time to, you focused in so closely, you were wanting to know, is there a meta-analysis on patients with neutropenic sepsis and refractory hypotension that were treated with and without steroids? Apparently not. So what you'd like to do now is let's go back a little bit. Is there anything on just patients with sepsis? Or actually, let's just say neutropenic sepsis, and let's forget the refractory hypotension for a minute. And we want to know about steroids, and we want to know about morbidity and mortality. Well, let's just see what happens if the fewer terms you use, the more results you should get. 54 is not bad, all right? So when you get down to 54, we could, what did we do? We did neutropenic sepsis and steroids. And let's see if we can make it even lower by doing morbidity. Oh, now we're down to 19. So let's quickly look at this and see if anything jumps out at us. The other thing you might do at this point is come over here to article types and click customize and say, I just want to know if there is a meta-analysis or a systematic review. And then you click show. And it's not telling you. I think you might have to redo the search, which is up here in the search bar. Now it's still showing those 19. So let's just look through here. Epidemiology, this is fungal respiratory infections, Bacillus cereus bacteremia, epidemiology, Candida, something in the treatment of relapsed and refractory Hodgkin's disease, sequential cycling, blah, 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 lymphoma, antifungal in febrile neutropenic patients. I don't see anything that looks like giving steroids to people with sepsis. Here is dexamethasone, but that's with multiple myeloma. Okay. And this is interesting because the student last night made the point that she usually doesn't use PubMed because it brings up all these results that don't really make sense to what we're looking for. So what we could do, since nothing jumped out at us there, we could keep looking, we could keep making our search terms better, or we can go to a different place. Let's go over here to up-to-date, and you might be thinking, if we look at evidence pyramids, and this is what we're learning about this week, I believe. and we look at an evidence pyramid. Expert opinion, you ask old Dr. Smith what he thinks is the best way. Well, that's the least quality evidence. We use that a lot, but that's the least quality evidence. Case-controlled studies, case series are a little better. Cohort studies, randomized controlled trials, you're getting really higher quality. And then when you get to evidence synthesis, that's good, but what's best is systematic reviews. So what is up-to-date? Up-to-date is critically appraised topics, evidence synthesis, okay? So it's almost as good as a systematic review, and that's why a lot of us use this clinically. Let's go to up-to-date, and let's see what happens here. Let's look at neutropenic sepsis. And the way up-to-date is done, it has an article about the condition, so you don't necessarily have to put the steroids and the refractory hypotension and all that. Let's just see if they have an article on neutropenic sepsis. Treatment of neutropenic syndromes. Oh, neutropenic, unexplained neutropenia, neutropenia in children, neutropenic fever. I don't see anything that's coming up with neutropenia and sepsis. Let's go up here and just make this into sepsis. In fact, what we might do, we're interested in bad sepsis with refractory hypotension. So let's just put some of our things here. Oh, look at there. Management of suspected sepsis and septic shock in adults. Let's take a look at that. Now, rather than read the whole thing, where I like to start is there something over here that says use of steroids in refractory hypotension and neutropenic sepsis? There won't be, but depending on what your question is, oh, look at this. So refractory, I think, means it comes back or it doesn't go away. So that would be patients who fail initial therapy, and there is glucocorticoids, okay, which are steroids. So that goes right here, and it tells us guidelines recommend against the routine use in patients with sepsis. However, corticosteroid therapy is appropriate in patients with septic shock that is refractory to adequate fluid resuscitation and vasopressor administration. This topic is discussed in detail separately. Okay, so at this point, you might be tempted to highlight this and put that into your, over here, as your abstract. Okay. The problem with that is that's not really an abstract. And although this is probably where you're going to stop in clinical practice, you're going to most likely keep clicking. So you're going to say, this topic is discussed in a detail separately. So let's look at glucocorticoid therapy and septic, shock. Once again, over here, so this is going to show you clinical evidence. Okay, so here's glucocorticoid therapy. Oops. It's in adult patients with severe shock. It tells you we suggest intravenous glucocorticoid therapy, hydrocortisone, be administered on a case-by-case basis. And then here's clinical evidence. So this is what we're looking for this assignment. There's our answer, okay? But what we're trying to find in this assignment is a peer-reviewed article that we can use in a future module where we are evaluating, critically appraising articles on treatment or on harm or on prognosis or on diagnosis. So what we're looking for is the actual article. So clinical evidence, 3 randomized, double-blind, placebo-controlled studies showed no mortality benefit, and there's the links to them. Now go back here. Placebo-controlled randomized trials is here. Okay, so that's good. So if we're being told about these trials in up-to-date, which is here, And we typically trust UpToDate, so we would just use that as the answer. But for this course, we need to go back to the original articles. So let's click on those, because here's another 3 trials that happened in the 90s. That's from the 80s. Then we had these in the 90s. And then they prompted the following larger randomized trials. So if you want, you could randomize trials, good thing. So here you've got 300 patients, which hydrocortisone decreased 28-day mortality. So see, there's your outcome measure. Corticosteroid therapy for septic, it's 499 patients treated with hydrocortisone or a placebo every 6 hours, blah, blah, blah. Patients were classified as having inadequate renal reserve. It didn't improve 28-day mortality. Here they actually compare those trials. Here's another trial, which came, it had 353 patients who had severe sepsis without septic shock. Well, we're looking for people with refractory hypotension, so that's probably not the best one. What's the adrenal trial? 3,800 patients on mechanical ventilators and vasopressors for septic shock, got either placebo or continuous IV hydrocortisone. All right, this is sounding good. And then they used corticotropin testing, was not used to attempt to diagnose critical illness. Hydrocortisone resulted in faster resolution of shock, shorter duration of initial mechanical ventilation. So that's actually a pretty good one. We might want to go back and see that. Let's just make sure that they don't say that so-and-so did a meta-analysis. There you go, right there. And I probably could have done this a lot quicker if I had told you, okay, look up glucocorticoid therapy in septic shock, and then come down here under clinical evidence and see if there's a meta-analysis, and then just go right to it. Because typically, anytime you have a meta-analysis, it's going to be better than reading each one of those trials, because somebody way smarter than us with way more experience than us has looked at all of these trials and anything else they can find in the literature, and they have summarized it in a meta-analysis, and that's really nice. So here you have older meta-analyses, newer meta-analyses that included these have reported that steroids confer nothing. So the other ones suggested that the steroids might benefit the patient. The newer ones say they don't. Here's a 2018 meta-analysis of 22 trials. Here's a second meta-analysis of 42 trials. I think at this point, you got 4 more questions to do. The ideal thing to do would be to click on the 85, and that's going to take you to that article. So this article is called Low-Dose Corticosteroids for Adult Patients with Septic Shock, a Systematic Review with Meta-Analysis and Trial Sequential Analysis. We reviewed randomized trials comparing low dose to placebo, so that's standard therapy, in adults with septic shock. Trial selection data, blah, blah, blah. Primary outcome was short-term mortality. Okay, if that's what we're okay with our primary outcome being, that's fine. Longer outcomes or longer-term mortality, adverse events. This looks like a pretty good article, doesn't it? So now what you need to do, let's say we're going to use this one. So for purposes of the assignment, what you're going to do is you're going to click on PubMed, and it's going to bring up the article. We can get the full text. Well, that's a good thing because you're going to need the full text for future assignments. But let's just get this assignment done. So here's the abstract. So you want to take the abstract and you want to copy it all. And you don't have to reword it or anything. This is not, you're going to cite this appropriately, and you've been told to do this, so you're not plagiarizing it. Go back over to your paper here. That was our abstract from UpToDate, and it's perfectly fine if you want to. I know some of you are Gunners up to date. If you want to put that in there and show me that you looked it up to date, that's fine. As long as you put the second one in here, which is this guy. So there's your abstract, okay? And now we need to source it. So sourcing, I know this is the first course for a lot of you, so let's talk a bit about APA citations. So APA is what you're going to use. That stands for American Psychological Association. And that's the format you're going to use for writing in the APA program, which is the advanced PA program that you're in. So it's confusing. But when we talk about APA standards, you either have already bought the book called the APA Style Guide, or the other thing you can do is just go up here to Google and type in OWL Purdue. This is the Purdue OWL is Purdue University website that has all of the, it teaches you about all the different types of citations. If you scroll down, you'll see here's the APA guide. And we want to know about formatting and style guide. And over here, what we're trying to format is we want to take all of this information up here. There's the journal it's in, the year, the month, the volume, the issue, the pages, what's called the DOI number. We want to take, and here's the article's title, and here's all the article's authors. So what I like to do is, when I'm doing this kind of research, is I just copy all of that, and I bring it over here, and let's get rid of that because you're not gonna, and I just paste it right here. It didn't work out very well. There we go. And now I need to put it into APA style. Well, we're looking at a journal article, so we're trying to do a reference. If we go back to the OWL, you're doing a reference list, and we're looking at an article that's in a periodical. So if we click on that, it's going to show us the basic form. Now ours is paginated by issue, because you saw that it had the volume and the issue and the page. So let's just copy that and put it over here as an example. Okay, and now we're going to delete that in a minute, but first let's write this up. Well, we got a whole bunch of authors here. So how many authors do we need to put, and how do we put them up here? Go back to the OWL, and let's see if we can find anything on
unknown caller.
Sorry about that. Reference list, authors, and author. Let's see what happens here. So this is exactly what you need. If there's a single author, that's the way you do it. If there's two authors, you say last name, comma, initials, comma, and last name, comma, blah, blah, blah. We have more than 7 authors. So with more than 7 authors, list by last names and initials, comma, separate author names. After the 6th one, use an ellipsis in place of the author's name, then provide the final author. There should be no more than 7 names. Okay, well that's what we have, because we have somebody did this study and wanted everybody's name on here. We have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, so come over here, and we're going to want to do Rygaard, and just put everything in just like this at first. This must be Butler E, must be his name. Here, I'll tell you what, let's do. Let's do 1, 2, 3, 4, 5, 6. So there's the first 6. And then we're going to have the ellipsis, the 3 little dots, and then we're going to have the last one. So the last one is this one. Okay. Now go back over here. This is actually easier. I should have done this. We should have used this as our put it right here above the other one. Okay. So we're going to have, and then you've got to go in and you've got to put a comma after each last name and a period. And then you got to get rid of whatever that little number is. And then you put a comma, and then you put a space, and then we do the same thing for the next guy. So I won't do all of these, but you see how tedious this is. I apologize, but this is what you need to learn, because if you want to publish anything ever, or if you want to get your degree, you may not your master's, but your doctorate, you might have to do a thesis, and your thesis has to be formatted correctly. So part of the APA, the Advanced PA programs training, is to train you in the APA style. But just for the purpose of time, let's go ahead and just say we did this. So at the end, we're going to put Delaney, comma, a period, and then you notice there's no comma after that guy's name, and then you put the date. So the date is 2018. Put that in parentheses. And then you put a period, and then we're going to put the article name, so that's this, followed by a period, and then we're going to put the journal name and volume in italics. So down here we see again the journal name and volume, but not the issue, in italics. So the journal name is Intensive Care Medicine, and that's abbreviated, so you're going to keep the, there that is, and we want a comma after that. It's okay to have a period and a comma, because the period signifies that it's an abbreviation. Then you have the comma, and then we want the volume number. The volume is 44. And then we want parentheses and the issue number, which is 7. And then we want a comma, and then we want the pages. Now, last night, actually, I told the student that you were supposed to put PP, but apparently that's changed. So they're not doing that. They're just putting the page numbers. So let's put down the page numbers. Our page numbers are 1003 to 1016. And then there's a period. Okay, now we're almost done. Let's get this a little. So this is the one we just built. It needs some work up here, but you know, do that later. But the other thing not to forget is, remember, they want intensive care medicine and the volume number in italics. So on a PC, Control I, and now that's in italics. So that, my friends, is your reference citation in APA format once you get these things up here cleaned up. So now you can get rid of all these other things. You don't need that anymore. And you don't need all this stuff because you took out of it what you needed. Oh, we forgot something very important. Sorry. The other thing you want to add these days is you want to add the DOI number. So the DOI number goes right at the end, right there. Okay? And that just makes it easier for people to look things up. They don't have to go find the Intensive Care Medicine Journal, volume 44, issue number 7, and go to page whatever. if you just, with the advent of the internet and hyperlinks, they gave everything in the world a DOI number. And now you can click on it and it'll take you right to the online version. So then we get rid of that. So this is our citation. This is our abstract. You don't really have to put the up-to-date one. Let's just get rid of that. There we go. So here's the abstract. And now you're going to turn this in, and you're going to have 5 of these. So up here you might have question number 1. Okay. And feel free to include all of this too, just like in math where you showed your work. Feel free to include that. You don't have to. You could just start here. But if I see it like this, I have a better idea of if you know what you're doing. So the question number 1, and here it would be good also if you were to put in parentheses or something, somehow label this as, what kind of a question is this? Is this treatment? Is this harm? Is this prognosis? We are looking at long-term mortality, short-term mortality. You could either call this treatment, or you could call it prognosis. It could be either one of those. So what I do is just put both of them down, because you have to have one of each. And you have to have 2 of one of them just because there's 4 different types of articles and I want 5 questions. Then you would come down here and you would do question number 2. Oops. Okay, so hopefully that's understandable. Real quick, write your draft question. Your draft question is just off the top of your head, what question are you trying to answer? Write down PICO over here in the margin, and then go to your draft question and put each answer, basically, each aspect of the question where it's supposed to be, to make sure that you are articulating all 4 aspects of a good research question, and to point out potential keywords that you're going to use when you do your search. Then you're going to go over here to the library. I usually start at PubMed, and it's a good exercise for you here because we're trying to learn, not just trying to get the assignment done so we can go have a holiday. Go to PubMed and use advanced search and type in a bunch of your keywords and see what you come up with. It might be, yesterday I had one student, we were doing appendicitis, looking at surgical versus non-surgical morbidity and mortality. If you treat appendicitis with analgesics and antibiotics versus emergency surgery. And we did the search, and we found that there's an increased incidence of bowel cancer after non-surgical treatment of appendicitis. So her question was something along the line of, in adolescent females with 1 day of pain that started periumbilically and now is in the right lower quadrant, who have been diagnosed by imaging as having acute appendicitis, what's better, surgical or non-surgical? So we talked about how she needs to get rid of that what's better, and she needs to say, what do you really want to look at? Well, if you're just doing the assignment, you could just click on this and you could rechange your question, and your question could be a harm question. So what is the difference in bowel cancer or in harm of surgical versus non-surgical treatment of appendicitis? And then you'd be done, because that one answers. So what I'm showing you is some of these, sometimes you'll come in here and you'll have an immediate article that answers your question. Other times you'll find that you don't. And it's interesting because this question we had about the neutropenic sepsis, man, we studied and studied and studied last night, and we just were not coming up with a good article in PubMed. So that's when we went and said, okay, well, it's probably okay. What you're looking for is, remember, you're looking for a systematic review or a meta-analysis that comes up in PubMed. If you find that, you're golden. Well, we couldn't find that. So we went to the next lower level of evidence. We went to UpToDate. And from UpToDate, we were able to not only find the answer, but we were also able to find what you need to have for this assignment, which is a randomized controlled trial. Interestingly, though, the reason I'm not telling you the student's name, and I'm just kidding with her, of course, is that we both agreed that if you weren't in an evidence-based medicine class and you were standing there with your phone in your hand and you wanted to find the answer, you probably wouldn't log into the library and go to UpToDate and all of that. If you needed the answer right away, you'd probably just Google it. Don't tell any other students that I told you that, okay? But that's what we all do. And this is why I'm thinking this course probably needs to be rewritten, because rather than teaching you a method that we don't really use clinically, we probably should be teaching you and having you practice stuff you're doing clinically, which is using Google, and then looking at each of the articles that come up to determine, how do you determine today if something that comes up on the internet is good evidence or not? Well, for example, let's try it. Neutropenic, neutropenic sepsis. Let's just put hypotension, steroids, and let's just, so put all your things in there. We're on images, we don't want that. Wow. And well, once you get past all the dang ads, the very first one is management of sepsis in neutropenic patients. Okay, that's pretty good. Here's guidelines, right? Management of sepsis, whatever Oncopedia is. I don't know what Oncopedia is, okay? That is a little concerning because we're not looking for Wikipedia or something like that. We're looking for a journal article. Here is actually a journal article, steroids in neutropenic patients with sepsis. So click on that, and it will take you to the article. And let's look at the article and see. It's in the British Journal of Hematology, so that's a peer-reviewed journal. Excuse me. It's from 2011. We could probably find something more recent, and you might want to do that if you're studying a topic that is being studied a lot. But then we find out actually what this is correspondence. So this is there is an article by this person that this person is referencing. So we know now that there is an article by this person in British Journal of Hematology. We could go back over here to PubMed, and we could put that person's name in and put down author last, and we could put down whatever the title of the article was, and we could do title, and ideally it would come right up. You can also, before I did that, I probably would go back to the article. Sorry, I've got too many tabs here. Here it is. And I would go back to the Google search and see if it has the article someplace. Here's one in clinical medicine. I mean, there's all sorts of things. And it's not, it doesn't matter. What I wanted to show you is that Google is amazing. And we always tell students from kindergarten, probably preschool, through graduate school, don't use Google. And I think we need to stop telling people that. What you're going to do it, whether we tell you to or not. And when I practice clinically, I Google everything. And in fact, when I teach face-to-face, when students ask me a question, typically I'll say, I don't know, let's Google it. And I'll show them how to do that. Because once again, if I give them the answer, they're just going to forget it immediately. But if I show them how to find the answer, then I think things are better. But it really frustrates them because students don't want to learn how to do it. They just want the answer. They just want to know what's going to be on the test. Not you students, of course, but other students. So another way you can do this, what I'd like you to do in this assignment is I'd like you to take your PICO question, I'd like you to put it down on a piece of paper and spread it out this way so that I can see that you've considered all aspects. And then I'd like you to go to the library and start with PubMed and do advanced search and do as many keywords as you can think of and search and see if something comes up. If it doesn't, play with the keywords a little bit and see if you can come up with an answer. If you spend more than 5 or 10 minutes and you're not getting your answer, then I'd like you to go to UpToDate, which is right there. You're already in the library. Just click on this tab and now you're searching UpToDate. See, UpToDate. See if you can find your answer there. If you find your answer, that's okay, but we don't want just the answer for this class. What we're trying to do is find an article that has the answer. And if you cite UpToDate, that's not going to really work in the upcoming modules. So what we need is the actual article. So see if you can come over here, find a meta-analysis, maybe see which one is the most recent and the one you think is the best. We're actually going to have a module on critiquing meta-analyses, so that's okay. And then click on the citation and here read the data. You're thinking, okay, that's the one I want to use. Then click on the link to PubMed, come over here to where you have the article, copy all this stuff back to here, the abstract and all of the citation, put it into APA format, referring to the, my thing just died, don't do that. Interesting. Referring to the OWL, okay, just put down OWL APAs, it'll bring up the Purdue OWL. Get it into the right APA format, and then before you go to the next question, come back to the article and download the entire article as a PDF, because you're going to need that article in the future, right? I think that's it. I think that's what I wanted to tell you. You guys are doing great. I'm going to post this along with an announcement. It's Thursday, 12/20, and this is due this Sunday. I think I'm going to extend the due date a week to make sure that everybody, this is really critical. It's really critical that you get your questions perfected and that you find good articles that we can use later in the class. Otherwise, you're going to get to a module on diagnosis and your article's not really going to be diagnosis, and you're going to have to go back and start over and try to find a diagnosis article to use. But if we can find 5 articles for the next 4 modules, I think we'll be good. All righty, well, that's it. Let me go back down here and stop sharing and end the meeting. Talk to you guys later. Bye.